everyone, welcome back to my channel. My name is Rebecca. If you've never been here, I am a nurse and I'm going to be talking to you today about gastric sleeve surgery and kind of the step-by-step process of what gastric sleeve surgery is, things that you need to know that you need to go through prior to getting the actual surgery. So welcome to my channel if you've never been here. Below, before we get started, subscribe, like, ding that bell. So you're thinking about getting a gastric sleeve and you kind of want to know where to start. The first thing you really need to do is you need to go into your insurance company and you need to see who covers it, because some insurance companies will cover it, other insurance companies will not, and some insurance companies will cover it, but you need to have a supervised diet. And they determine how many days you'll be on that. Sometimes it can be up to 90. Just depends. I've heard of insurance companies not covering it, so people pay out-of-pocket fees and they go to Mexico instead and they stay at a resort type hospital thing and they have their surgery down there and they kind of heal down there. That's not really an option for me, 2021 right now, because of COVID, and traveling is very difficult, especially traveling out of the country. I mean, we just went to Hawaii in January and that was kind of an ordeal too. But, you know, I'm lucky enough that my insurance company is going to cover mine. So make sure you definitely check that out first. Next, you're going to go to your initial consultation. I went there. That's kind of one of the hardest things at first, is just making that first leap. At least for me it was. They're going to explain to you the gastric sleeve process of what he does. The doctor, they sat me down, they collected my height and weight. He explained the surgery. He kind of explained how, 2 weeks prior to the surgery, I'm going to have to be on an all liquid diet. I'm not going to be able to really have caffeine after the surgery for a while. After surgery, I'm still going to be on a liquid diet, and then progressively go to a puree diet, and then eventually I'll go to soft foods and then hard foods. They ask you your why question, like we said in our last video, because they want to make sure that you're doing this for the right reasons, and they will turn you down if you're not honest about your why, or if you are doing this for the wrong reasons, or if you even seem hesitant in it. Just FYI. They don't want to do this on somebody who's not going to be 100% like, let's go forward, let's do this type of thing. So I went to my initial consultation. They collected everything. He did his assessment on me, listened to my heart and lungs, asked me about my past medical history. I told him the only thing I have is PCOS, or polycystic ovarian syndrome. He said I was a great candidate, that a lot of my body weight was metabolic and hormonal. I said, I know. He said, but you do need to have your discipline too, because not all of it is. And I said, absolutely, I know. I know my sins. So after that, he gave me the steps, and Hannah, who works there, Dr. Huguenot and Hannah, at Bay Area Surgical Center, which I'll put the link below if you want to check them out. They gave me a list of things I need to do prior to getting my surgery. Okay. The first thing I need to do is I need to get a letter of necessity from my primary care doctor. Okay. So I am a nurse, so I'm probably the worst patient in the world. And so I'm one of those do what I say, not what I do type of people. And I think, I can heal myself and do whatever. And so I'm just being honest. I hadn't seen my primary in like 3 years. So she's like, maybe, what's going on? Why am I receiving this thing from Bay Area Surgicals that you want to get a gastric sleeve? And I told her, I was like, I've been fighting this. And she goes, yeah, I know you're overweight and you've been trying some of the different diets and stuff like that. And I said, yeah, they're just not working. And she agreed, finally, after I need to get some blood work done, that it would probably be the best route for me as long as I was just super careful. One of the things I need to be super careful about is making sure that for at least 6 months to they're wanting a year that I'm not getting pregnant. So big concern for them, especially for girls. Guys, obviously, I don't think you gotta worry about that. But the next thing I had to do was I needed to call billing. I needed to call my insurance company to see what my out-of-pocket fee would be. Luckily, my out-of-pocket fee for my whole surgery would be $1,008. And that's not, it's a lot of money, but that's not a lot of money as in the grand spectrum of surgeries, to be honest with you. So I was actually pretty pleased with that. I was like, oh, okay, all right, we can do this. Like, that's fine. That's a few shifts. I can do this. Then they said I needed to do a psych evaluation, which I'll have another video that's in depth about the psych evaluation because I did complete that. But I needed to pay out of pocket for my psych evaluation. It was $125, whatever. They did it over the telephone. The guy was super awesome. And my primary care doctor did her assessment of me, through video. So you can ask, especially right now, because it's COVID, you can ask for them to do, video appointments or telephone appointments, and they will accommodate you, because sometimes I just don't have the time to get into the office, but other times I'm a nurse and we again are still in the world of COVID, and certain people, you know, they just don't like seeing nurses in waiting rooms. It freaks them out a little bit. So I don't want to make anyone uncomfortable. So that it was easiest on both ends. So the next thing that I still have to do is I have to do 2 nutrition evaluations, both of which you have to pay out of pocket. I think it's going to be about $250 total for both of them. Again, not bad in the grand scheme of things, because I'm thinking to myself, over the years on pills and diet material, I have spent well over a couple $1,000s, if not up to almost tens of thousands of dollars. So why not just do this and be done? I mean, obviously, if I can afford that, I can afford this. I mean, I'm not saying I'm super rich, because I'm not. RN does not stand for rich nurse, okay? Stands for refreshments and narcotics, because that's pretty much what I give all the day in ER. Anyway, so they go over the nutrition in those, and basically they do a pre-op one and then they do a post-op one. For the pre-op, I've read and I've already started to do part of my nutrition stuff. One of the main things that I've done is, the first thing I did was I had to give up caffeine. And I know for some of you that's not like a big deal, but I was super addicted to caffeine, especially coffee. I love coffee. And coffee is not only essential for work for me, but it's also like a social thing. I love going to local coffee companies. I love smelling the fresh roasted beans. I like trying new drinks, stuff like that. So that one's hard. And honestly, anytime I detox off of caffeine, I kid you not, it takes like 2, 3, 4. It took 5 days for me to really be normal. Again. And by that I mean, like, during it I was pale. I didn't feel well. I was sweaty. I was going through the shakes pretty much, because everybody forgets that caffeine is a drug in a way. And so I was having massive headaches. I was light sensitive. I was sound sensitive. It was just not pleasant. I was nauseous. Oh, threw up. Yeah, that was great. It was like day 3, pretty sure. Yep, day 3. Threw up. And I was like, I hate throwing up. Like, with a passion. I hate it. So that was one thing. The next thing that you're gonna have to do is you're gonna have to limit your portion size, because that's coming next. And right now, the earlier I've read, I've talked to doctors, I've talked to other patients, I've read so many blogs from these beautiful men and women who have gotten this and are, you know, giving me their best advice to give to others, that the earlier you get into ketosis prior to your surgery, the faster you lose your weight after your surgery. It makes total sense. It really does. And you're gonna have to be on a keto diet after surgery anyway, just for a little bit, not for like life, but you're gonna have to do it. It's just one of those things. And then they also talk to you about how you have to control your portion size, because your stomach, they're removing like a ton of your stomach. So you're gonna get only about 4 ounces a day. And they want to make sure that you absorb everything you can from those 4 ounces, not a day, sorry, of a meal. And because if you don't, you're not getting your nutrients and you're going to be malnourished. And then, you know, if you don't absorb your vitamins and your nutrients, then you have some bad side effects that can happen to you. So you really, really need to watch that and be careful of that. The next part that you're going to have to do, which mine is scheduled for the end of the month, is you're going to have to do an EGD. And that's kind of where they, if you don't know what it is, it's where they stick like a camera down your throat and into your stomach. And it's a quick process. I mean, it's not very long. They do knock you out for it. They're not going to do it while you're awake. It is a type of like outpatient procedure. So right now for me, I'm going to have to get, you know, a COVID swab just to be able to do it, which is fine. It's life. COVID swabs are like every day for me. But they're looking for any type of ulcerations or anything down your esophagus, any thinning, something that is going to be bad for your surgery. So a lot of people, I have it a little bit. It's mainly just like normal people when you eat certain foods, but a lot of people have gastric reflux or GERD. And when you have that and it's not treated, what happens is that reflux goes up and down, up and down, up and down. And then it starts thinning the lining and it will cause ulcerations. And then you start getting perforations from that. And if you ever have a perforation, you need to go to the ER because that's a really bad thing. But what they're trying to avoid is that when they go in, nothing bad will occur based upon those. So the next thing you have to do after that is you have to do an exercise evaluation, which my EGD and exercise evaluation are literally back to back. So we'll see how that goes. But what you do with that is they're going to tell you some of the exercises that you can and cannot do post-op surgery. I'm limited in what I can do right now just because I have bilateral torn meniscus and a sprained MCL from an accident I had at work, but I'm getting a lot better, and by the time I have my exercise evaluation, I should be about 80%, which is fine, because the first exercises they make you do are all chair-based. So you're going to do a lot of chair exercises and a lot of bending. They're going to talk to you about how you're going to have to do a lot of toning. They're not looking for cardio. Cardio would be good, but not right away. You really want to focus on toning. And the reason you want to focus on toning is because you're going to be losing a lot of weight pretty quickly. And this is like one of my biggest fears is you lose a lot of weight and then what happens? You have a lot of skin. So if you're older, your elasticity is not as good as it used to be when you were younger. So you have all this saggy skin and then you're like, does this mean I have to get like a lift, or does this mean I have to, get this taken off surgically? So that's just another procedure. That's more money. I am very stingy, so I don't want that. So I'm just trying to avoid that. So I highly suggest taking your collagen and your biotin. They sell them in like gummies now, especially the biotin. The collagen is usually a powder. It's gross, not gonna lie. But if you mix it in something like your smoothie, one of your shakes, something like that, it will be better absorbed. And I highly suggest taking it before your surgery. Like, start taking it. I haven't started taking my collagen. I started taking my biotin. I'm waiting to take my collagen when I start my liquid diet. Because one of the biggest things they see is, again, the elasticity, but they also see hair thinning and hair loss. Because again, you have high protein, you're not absorbing everything, and you're kind of in a way starving your body, so you're not getting as many nutrients. So you have to be careful of absorbing everything. So for me personally, I would like my collagen to be built up in my system a little bit. And then I feel better about that because I have very long hair. I have very thick hair. I do not want to lose it. Like, I love my hair. I play with it. It's very shiny. But I mean, to a woman, their hair is one of their prized possessions sometimes. So, they just be careful. That's all. So after your exercise evaluation, that's when you get ready for the actual surgery, like I said. If you do your dieting before, your surgical date, because you have to be on liquids 2 weeks prior to surgery. Why do you need to be on liquids and they give you a liver cleanse that you need to do? Why? Well, because when the surgeon goes in there, your liver is quite big, and so he needs it to shrink a little bit so that laparoscopically he can go in and he can go into your stomach. Okay, so it's basically just to help the surgeon be a better surgeon. And why would we argue with that? Since the man is cutting you open, you might want to help him out. Just saying. All right, so what is VGS, or vertical gastric sleeve surgery? And, who gets it? Well, in order to be able to get it, you need to have morbid obesity. And unfortunately, morbid obesity is defined by your BMI still. We have yet to find a better way to define morbid obesity, which I think is ridiculous because although I'm morbidly obese, there are people that have BMIs that are a lot higher than me, but their BMI is not accurate because of their lifestyle. I'm talking athletes, stuff like that. Like, their BMI does not match their body shape, pretty much. Typically, you qualify with a BMI of about 35 to 39. If you don't know your BMI, it is based upon your height and weight. You can Google BMI calculator and you can figure it out quite easily. It's not that hard. They will also look at you, different issues that you have. I don't have these, so I don't have to do that part of the procedure, but they do look at you if you have diabetes, sleep apnea, or high blood pressure, because they need to get that under control before they can give you the gastric sleeve, especially diabetes, because again, like I said, it's all about nutrients and absorption. Usually this isn't pertaining to diabetic 1s or insulin dependent. It's usually pertaining to more of the diabetic 2 or the diet dependent diabetics, just FYI. So that is pretty much who is qualified for it. So what do they do? Well, they go in laparoscopically down below the liver. They go in by your stomach. They're removing your stomach, and it's like 80 to 85% of your stomach is being removed. They literally have pictures. I'll tag a picture too. But you have your stomach. They remove, like, again, 80% of it. So you only have the small little tube left. And it has the receptors in there to, hey, I'm hungry. Hey, I'm hungry. So you have more receptors. So it goes, hey, I'm full. Hey, I'm full. So you feel full faster because it's being filled up so quickly. And that's why you can't overeat. Because if you overeat, what happens is you get, sounds gross, but you get frothy, nauseated vomit. And you literally are stuffing yourself till you throw up. That's one of the most common things that I've read that is a side effect, especially post-op, is that they don't realize their portion control of how much they need to eat, and they vomit it all back up. What are some complications? Well, some of the complications are hernias. You can get obstructions. Do not chew gum. One of the big things. They don't like the xylitol, especially in gum. It whitens your teeth. They don't like it. I don't quite know why yet, but I can figure it out. It has something to do with the nourishment. They also don't like it, believe it or not. They said because if you accidentally swallow it, it becomes an obstruction. Well, yeah. Ulcers, especially if your gastric acid hasn't settled down yet, you can get a little bit of ulceration. Vomiting, we already talked about, the frothy vomit. And then your gallbladder. And I was really concerned about the gallbladder. He said that for this procedure, less than 1% of the people need to have their gallbladder removed because, most people who have morbid obesity don't realize that they already have active sludge and gallbladder stones in their gallbladder. So they already have the odds working against them. And then you're putting that filter into hyperdrive and you're just trying to filter all of that stuff out. And that's why your gallbladder goes bad faster. You're running it like crazy. So a lot of people have had gallbladder issues, but it's because they're not sticking to the diet properly, and they skip the puree phase because they're just like, I just want to eat food. And they go straight to the hard food phase. So they skip puree and they skip the soft food and they go straight into hard food. And you're like, okay, well, that's kind of the reason. So he's like, as long as you follow the diet, he's like, it's not really that hard. And I'm like, okay. He said more people have complications with their gallbladders that have gastric bypass, which is completely different than the sleeve. Okay. The golden question, how fast do I lose the weight? Well, he said in 3 to 6 months, I will have 50 to 60%. So 3 to 6 months, I'll have 30% of my body weight off. And then that's at 3 months. And then at 6 months, I should have up to 60% of my body weight off. So again, that is scary in a sense towards me, because I'm like, you're telling me, so my highest weight was 328 pounds, okay? You're telling me that I can lose like 100 pounds, just 110, boom, just like that, like crazy. Like, okay. Like, I don't know. To me, it seems fast. I hope it's fast. But on the other end, I hope it's not so fast that I can't keep up with my toning and then I look weird. I don't know. I might be overthinking it. It's very possible. I'm a nurse. I do that sometimes. But life. How does this change your life? Well, again, portion sizes is the huge thing. And that's not like for, 2 months or 2 years. That's for the rest of your life. And if you don't do portion, controlled, then you're going to stretch out your stomach and you're going to, the sleeve, you're going to stretch your sleeve out and then you're going to gain all the weight back. And then what was the reason for doing it in the first place? You're going to be on the keto diet for a little bit. So I personally don't want to go through keto flu after my surgery. So hence why I'm doing it before my surgery. Let's just get it done. I'd rather, detox off of caffeine. All right, done. Next, go through the keto flu because that's 2 or 3 days where you feel like crap. Fine. And then focus on surgery so that my body can just heal faster. Nutrition absorption, you're going to be taking vitamins pretty much for the rest of your life, just because you're going to need to have those absorbed. I haven't tried it yet, but I have seen vitamin patches. I have seen vitamins powders that you can put in drinks and stuff like that. The patches really interest me. Saggy skin, we've already talked about that. 30 minutes before and after eating your drink. Okay. Sorry. So, because you're putting so much down your throat, your 4 ounces, and you're not absorbing all of it, you are not supposed to be you're not supposed to be drinking 30 minutes before you eat or 30 minutes after you eat. Because what that does is it washes it out. So you're not absorbing any of the nutrients. And you're like, I can use this for evil. At least that's the first thing I think. Like, so you're saying, if I have a bad day and I need to get rid of the evidence really fast, I can just flush it out. Yeah, no, that's not really how that works. So you can flush it out, but if you drink afterwards and you drink too soon, because again, you can fill up and then you just throw it up. So no, I was wrong. You try and find a way around the rules. Duh. That's what we all do. Okay, caffeine and alcohol. Okay. So you can't have caffeine right now. They really don't want you to have caffeine ever again, blah, 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 blah. You can't have caffeine right now. That's fine. It affects you differently because, again, you're absorbing things. So it affects you a lot differently. Alcohol, same thing. You're going to be a cheap drunk. You shouldn't be having alcohol. They're going to tell you don't have alcohol for a long, long time. People who I have talked to that have had their sleeve and had alcohol or caffeine afterwards say they have to have it in a very small amount because, again, you're filling it up, you're filling up the tube, but because they said caffeine hits them differently, especially they get jittery, and then alcohol, they get drunk a lot quicker, so they don't want to lose control, basically, so they're just being careful with it. So that is all for what it is and stuff like that. So some of the questions that I had asked the group that I can present to you is stuff like, what is your biggest fear? What is your best pre-op and post-op tips? I asked if anyone has tried different products. What items could you not live without? And that really helped you pre and post-op. Binders, if you need to wear a binder. How does your hair change? Do you have to use different products? What are your favorite vitamin packs? What affects you physically and mentally afterwards? And what has been the hardest for you? I talk about, like, has anyone started their Peloton again? Like, how long until you get to use your Peloton? Because I miss it. What was the first moment that you saw yourself changing? And then stuff like, what am I not thinking of? So some of these questions, I'm just going to read some of the people's answers really quick. And that way you're not just listening to my voice and my words, but you're listening to other people who are already post-op and they give you advice. So what is your biggest fear? This lady says, for me, it was the actual surgery, but that proved to be way less scary after the fact. What are your best pre and post-op tips? She said, treat every day as a new day. Do the work beforehand with a counselor so that you can get to the bottom of your food and emotional issues. Being emotionally ready for this journey is very important. I asked her if she's tried Protein O2. If you don't know what Protein O2 is, I'll go through another section where it has all the products that I use, but it's basically this drink. You can get it off Amazon. It has like no sugar in it. The coconut is so good. It tastes like a pina colada, but it has like 15 grams of protein in it. So it's actually very good for you. And especially since after your surgery, they're going to want you to have somewhere in the range of like 60 grams of protein a day. You really want to get that bang for your buck because you don't have a lot of space to put food in. So you want to make sure you get high foods with high concentration of protein in, so you're getting all of your fulfillment of protein for the day. She said that she doesn't she prefers to get her protein with her food, but she does drink Premier protein shakes for breakfast most days. I said, what are things you do to keep your skin tight? She said, I'm working out and strength training. This won't totally get rid of the saggy skin, but it really does help. What are items pre and post you had to have with you? And she said, before surgery, I stocked up on broths. I would buy 2 or 3 a week for the month or so before surgery. She goes, I didn't buy a lot of things other than that because I knew my tastes might change, and they did. I borrowed a recliner from a friend to sleep in right after surgery, which was a lifesaver. I also bought this blanket that has sleeves and legs in it. It was perfect for sleeping in the chair. I also bought a little 2-ounce cups so that I could put my yogurt and my pureed foods in them. This way they were ready. My friends bought me a NutriBullet. This was perfect for the pureed stage, and I still use it pretty often. I also bought a neck pillow for sleeping in the recliner. I asked, do you wear a binder? She said, I did not wear one, but really needed one. I bought a maternity belly support undershirt, and it did the same thing. I piped a stitch and needed the compression. Has your hair changed? She said, yes, I think. I could just be super worried about this. Everyone around me says it looks fine and normal, but I think it's coming out at a quicker rate, and I'm a little bit worried about that. I told you. Do you use different products in your hair right now? No. I'm going to look more into that, but I'm pretty sure you should probably use some different products in your hair that are going to help strengthen your hair. Particularly, and I know it's expensive, but the Aveda brand seems to be pretty good, but let me do more research. Don't quote me on that yet. What are your favorite vitamin packs? She likes Bariatric Fusion, but she's not good about taking them if she's honest. Not good. What after effects physically and mentally have been the hardest for you? Like I've mentioned before, counseling and getting your mental health in check before you have the surgery is top priority. I have been in counseling and continue to go monthly. This is a vital part of making sure you are successful. We all got to this place for one reason or another. Find yourself a good counselor if you don't have one already. She talks about different exercises. I asked her about the Peloton, and she said, I already mentioned that I'm working out about 3 times a week. I go to Planet Fitness and love it. It is body inclusive, and I have never felt out of place there. I do cardio and then a lot of strength training. I asked her about the food and beverages. She said, I have chosen to stay away from all things that are my triggers. I have come so far that I don't want to even go back to where I was. I was never a sweets person, but I love more salty things. I said, what was the first moment that you saw yourself changing? And she said, fitting in the clothes. I haven't been able to wear in years certain jeans, and even then those jeans get baggy on me. But honestly, there are days when I don't see a change at all. When I look in the mirror, while I know I'm in my head that my body has already changed dramatically, sometimes it's hard for me to see that I am already down 66 pounds and have had surgery on December 7th. Said, what am I not thinking of? The only thing I would add to this is make sure you surround yourself with friends and families that are supportive and constantly cheering you on. Having this support is so amazing. You've got this. This group is amazing for encouragement and tips. Keep focusing on your why. Make a list of your why you are having the surgery. Add to the list as you go about your life. List out the goals you have after losing weight. What are things you are looking forward to doing? Keep looking at this list. It's very exciting to check things off as your weight gets lower. Yeah, I plan on doing that, and I'll do a separate video for that too. We'll do one more lady that responded to the questions. All right, so what was your biggest fear? This lady, and by the way, just if they ever see this video, thank you so much for answering these questions, and thank you for being as honest as you could. It's very hard to say things like this. People don't understand that a lot of it is embarrassment and pride. But you know what? These ladies did something about it. They stepped up. They're ahead of me. They're ahead of the game. So kudos to them. I love it. Your biggest fear. For me, it was the surgery itself, but the fear of failing afterwards. What are your best pre-op and post-op tips? Ask all the questions, which kudos to you. She liked it. She goes, find your tribe and have them rally around you. Your body is yours, and don't compare your journey to anyone else. We didn't gain weight overnight, and it won't come off overnight. This is a tool, not a band-aid, so use it that way. Lastly, give yourself some grace. She has not tried Protein O2 yet, but what are things that you are doing to keep your skin tight? She goes, girl, when you find out, let me know. My arms are like yucky back wings, and I know my stomach will have saggy skin, but I'm trying not to worry about it right now. That's awesome. What are items pre and post you had to have, help you? And she laid vitamins. She goes, loved my Fitness Pal to help me keep track of everything. Help build Built bars. Oh, loved Built bars and Fruity Pebbled Isopure. That's a protein drink. A pillow, handy for the car ride home, and when you get up to walk in the hospital, you're gonna want that pillow. Do I need to wear a binder? She said, I didn't wear one, but I've seen others wear it, and it might have helped me. So binder's still like, maybe. Has your hair changed? She said, not yet, and I'm nervous about this, hoping it doesn't. Girls and their hair, man. Do you use different products in your hair as of right now? No. What are your favorite vitamin packs? Love the Fusion ones. They are one-stop shop. What after effects, physically and mentally, have you been the hardest for you? The mental part of this has been a struggle for me. I wasn't prepared for the struggle of how much I relied on food. Okay. I mean, honest. I love Peloton. You know, what strengthening and tightening exercises are you doing? And she's like, I'm so jealous. I need a Peloton. I need a Peloton in my life. I need to do strength training. So I really honestly think for saggy skin, and you'll see my journey. We'll see if I'm right or wrong. I'm really hoping I'm right on this one, that if you start off early and you do a lot of toning, just toning, you could probably get some of that elasticity back. We'll see. I don't know. What food and beverages affects you the most? Like sugar, alcohol, or medicines? She goes, sugar hasn't, although I haven't eaten a lot of sugar like before. Too scared to try any alcohol yet. And I haven't had any issues with taking meds. Okay. I've personally, when I asked about meds, I specifically am looking for stuff like melatonin or Benadryl. Does it make you more drowsy quicker? Because like I know my onsets for how long after I take a melatonin or how long after I take a Benadryl that it's going to kick in. And for me personally, I think that it's going to ramp up that speed. It would just make sense. But I don't know. What was the first moment you saw yourself changing? She goes, when my skinny pants, oh girl, skinny pants. I said I'd never get back in, were baggy. And I said, what am I not thinking of? And she said, you have all the questions coming up all throughout the journey. Just keep your eye on the prize. Okay. So that's all the questions for right now. We'll talk in the next, another video, basically about some of the psych stuff. And then we'll do a products video so that you can see kind of what I'm doing, what I'm using. You can choose to do my way, you cannot, that's perfectly fine. And then I'll show you some of the stuff I got too for post-op, so that you can really just see the changes in yourself, because some of the stuff that you read is not that you're going to see changes necessarily on a scale at first, but you're going to see changes in your body. So they call them, you know, non-numerical victories, which, you know, it involves losing inches. And you know what? Screw it. If it involves losing inches and the number stays the same on the scale, like that's great. That's still a win. So, I will talk to you later. And we'll hit those videos coming up in the next couple days here, okay? So, as always, be strong, be brave, be beautiful, but mainly just be you, okay? Good night, everyone.